Are you ready for the next health data attack? Thanks for joining us today. In this episode, we are talking about something that matters to every healthcare organization: incident response. It's a topic that usually comes up only when something has already gone wrong, but the truth is the best time to think about incident response is before it's needed. Today, we're going to talk about what a solid program looks like, where most organizations fall short, and how to keep it practical so that it actually works when you need it. When you look at the last few years, one pattern stands out. Data breaches in healthcare aren't slowing down, they're growing. Industry reports show hundreds of major incidents every year, impacting tens of millions of records. And that's just what gets reported. Behind every headline breach, there are smaller events: misdirected faxes, lost devices, wrong patient emails that never make the news but still count as reportable under HIPAA. That's the reality, and it shows that this isn't a theoretical risk. There are real exposures involving real patient information and real regulatory follow-up. So, let's start by framing what incident response actually means in a healthcare setting. It's not just what happens after a breach, it's the full life cycle. Preparing your team, detecting when something's wrong, containing it quickly, recovering operations, and learning from it so that you are stronger for next time. For healthcare, that process carries extra weight. It's not just about systems or data, it's about continuity of care, maintaining trust, and protecting the privacy that patients expect every time they share information with you. Let's break this down piece by piece. The first step is preparation. Before anything happens, you have to know where your protected health information lives. That includes every system, every network, every vendor connection, every backup location. If you don't have a clear picture of your data flow, you can't respond quickly when something goes wrong. This connects directly with your security risk analysis. Your risk analysis is supposed to identify your key assets, your vulnerabilities, and your likely threats. Without that, your incident response plan is built on guesses instead of facts. We've seen organizations get into trouble because their security risk analysis was outdated, or it was too narrow. It only looked at one department, or it ignored certain vendors. When OCR investigates after a breach, that's one of the first things that they ask for: the most recent risk analysis and what steps were taken based on it. So keeping that document current isn't just paperwork, it's your playbook for how to respond. If your SRA hasn't been updated in 2025, our team can help you get started with that today. The second piece is defining clear roles and responsibilities. Everyone on your team should know who does what during an incident, who declares the incident, who leads containment, who communicates with leadership, who contacts your legal or your compliance counsel, and who speaks to patients or the media if needed. It's surprising how many organizations have an incident response plan that's technically complete, but no one on your team could actually explain it. The best plans aren't just written, they're practiced. You can have the best document in the world, but if your staff doesn't know where it is or what it says, it's not going to help when you're under pressure. Run tabletop exercise, simulate real scenarios, see where people hesitate or where decisions may be bottleneck. That's where you are going to find your weak spots. Next comes detection and analysis. This is where preparation really pays off. The faster you detect something unusual, the smaller the damage will be. Most large breaches started small: an email click, an unused account, a misconfigured system that no one noticed. Good detection means having your monitoring tools tuned correctly, but it also means reviewing logs, watching for trends, and having people who know what normal looks like so that they can spot when something's off. If an alert comes in, your process should guide you through verification. What's happening, what data is affected, and how far that it may have spread. You don't want to overreact to a false alarm, but you also don't want to lose time debating whether to act. Establish thresholds early. Decide what counts as an incident and that triggers a response, and what can be handled as routine IT work. Once you've confirmed an incident, it's time to contain and recover. This is where clear planning prevents panic. Containment means stopping the spread, cutting off access, isolating systems, disabling compromised accounts. Eradication means removing the root cause, whether that's malware, a compromised password, or a bad configuration. Recovery means restoring normal operations securely, making sure data integrity is verified and confirming that the systems you bring back online are clean. Every organization should test its backup and restore process consistently. It's not enough to know that you have backups, you have to know that they're actually going to work when you need them. Next comes notification. In healthcare, this is a regulated process. If unsecured PHI was accessed or disclosed without authorization, HIPAA requires you to notify affected individuals, the Department of Health and Human Services, and sometimes the media. The timeline depends on the size of the breach, but the key is documentation. You have to show how you identified the issue, what you did to contain it, and when you made those notifications. And here's where a lot of organizations trip up. They do respond, but they don't document. Or they send notification letters that lack the required details. Or they take too long to report, and OCR counts that delay as part of the violation. Even small issues like a missed patient access request or a failure to follow your own policy can result in enforcement. And that's why it's so important to have both legal and compliance teams looped into incident response. They can help determine what counts as a breach under HIPAA and what doesn't, when notifications are due, and what corrective actions are necessary to close the loop. Finally, there's the step that often gets skipped, the review. After an incident, the goal isn't just to move on as quickly as possible. It's to understand what happened and to make sure that it doesn't happen again. That means asking questions. How was it detected? What slowed the response? What controls failed? And what can we fix? Update your procedures, retrain your workforce, adjust your monitoring. That cycle is what turns incident response from a checklist into an actual security practice. Let's talk about vendors for a moment, because third-party incidents are now one of the biggest drivers of healthcare breaches. You can have a strong internal program, but if one of your vendors mishandles patient data, you are still on the hook. Every vendor that touches your data should be under a business associate agreement, and that agreement should clearly outline how they'll respond to incidents and when they will notify you. And don't stop there. Ask questions. Do they have an incident response plan? Have they ever tested it? How do they track subcontractors? Do they know where their data lives in the systems? Those questions aren't overkill. They're part of knowing whether your vendors are as ready as you are. Documentation ties all of this together. Your incident response plan, your risk analysis, your vendor list, your contact sheets, all of this should be easy to find, up to date, and reviewed at least once a year. If you change systems, add new services, or go through a merger, update it then too. Communication is another major piece. During an incident, your internal teams, IT, compliance, leadership, operations, all of those need to stay aligned. A clear, steady flow of information prevents confusion and helps everyone to stay on the same page. Externally, patients and partners need honesty and clarity. The tone and accuracy of your communication can determine how much trust you retain after an incident. When you look at OCR's recent enforcement activity, a pattern stands out. Most of the organizations that face settlements didn't fail because of sophisticated hackers. They failed because they didn't have an updated risk analysis, or because they had a plan that wasn't followed, or because documentation was missing. These are preventable problems, and that's why incident response isn't just an IT function. It's part of compliance, part of patient safety, and part of good leadership. A breach doesn't only expose data, it tests how well your organization can respond with a plan. So if it's been a while since you reviewed your plan, or if your last risk analysis doesn't reflect your current systems and vendors, then start there. Review your vendor list, update your policies, schedule a tabletop exercise, and confirm that your backups are working. An incident will happen eventually. What matters is how ready you are when it happens. At Medcurity, we help organizations take the guesswork out of that process, from helping you complete your security risk analysis to keeping your documentation audit ready. Our goal is to make compliance clear, manageable, and proven. So thank you for listening. Stay proactive, stay ready, and keep protecting the trust that your patients place in you.